Now I want to show you inside the mouth. You saw the area where the tooth was missing on the screen. Now check out how it looks like inside the mouth. Okay. It's right here. That's where our missing tooth is. Okay. It's a big missing tooth space. All right. So we're gonna be drilling and putting a implant right in there. Okay. So I go through a series of drills and then I put the screw in. It's a screw. That's what it simply is. An implant is a screw that needs to be placed in the proper position and the right amount of bone with the right type of tissue around it so that it lasts the patient for a long time and supports a tooth on top of it. Cool, so this is the jig that's gonna clip inside the patient's mouth. So check out how I'm gonna clip it in. It's important for this to be stable. So see how it's connected well. Next, what I'm gonna do, I'm gonna take the first drill. The first drill is the guide drill. If you notice, it's sharp. It's a sharp drill. Patient is numb. If you feel pain, Delor, just raise your left hand. Okay, I'll stop right away. So I'm gonna measure the drill length first, okay? Measuring that. Place it in the mouth. If you notice the top left corner, you see like a bullseye thing. Open a little more. Right, so I'm positioning this right where I want in the middle. Now, once you're done with the guide drill basically is a guide, just like the name says. I remove the guide drill, and next I'm going to put the next drill in line, which is a 2.0 millimeter drill. So you can put the drill right on the handpiece. And before I go into drill, I need to measure. So I need to measure the length of this drill. It's gonna be like an open bigger, a video game. It's abra más, poquito más. Now, before we go further, we want to cross-check and make sure that our plan, the computer, that there's no failure in the technology. So the way we do that is we grab a guide pin, and where I drilled, I'm going to put this in, and my awesome assistant is going to take an x-ray, and we're going to see if it's going the right way. So this guide pin, if you come here, you'll see, we're just gonna put it right where the drill is. All right? Right there. And we're gonna look and see if everything is going according to plan or if there's a deviation that we could have overseen. Okay? So next, we're gonna take an x-ray. So it's a little too far distal, right? So we want to move it more mesial. So we corrected the actual position. We moved it more mesially. And now we're going to take another x-ray and let's see how that looks right now. And that looks a lot better where we want it to be. And that's the value of taking verification PAs. VPA is a very important step. You don't want to drill all the way to length because if you are going off course, you want to have enough bone that is intact so that you can correct course. Awesome, so we drilled and now it's time to place the implant. We corrected the angulation and the placement to be mid-crestal and mid-ridge. And now, opening the implant. The implant comes in a little fancy schmancy, and then this is it, right? So I'm gonna take this screw and I'll put it in where I made the access hole. The torque wrench. Come from this side, actually. Now let's take an X-ray. Now the moment of truth, right? We made the drill. Now we placed the implant. Now we're taking the X-ray. We want to see if the implant is positioned in the place that we planned it to be positioned in. Not bad. I'm gonna sink it in a little deeper, but I'm happy with it where it's at. Just want to sink it in a little deeper, and then I'll put a cover screw because this site has a soft tissue deficiency that I would like to treat with a free gingival graft in the future. All right, let's do the final step. Awesome, so it's at the right depth, the depth that I feel good about it being at. Next, I'm gonna put a cover screw. There's two types of screws you can put. You can put a cover screw, which is under the gums, or you can put a healing cap. A lot of the times I put a healing cap because studies show there is no difference between healing cap and cover screw. However, in cases where I wanna do future surgeries to develop the implant site, to engineer it furthermore, like in this case, we have deficient soft tissue. So I'm gonna go ahead and put a cover screw so that the gums heal over it. So when I go in to do my surgery next, I'm not dealing with a healing cap. So this is the cover screw. And I know this might sound like jargon if you're not a dentist or if you're new to implant dentistry, but when you get exposed to this multiple times, you'll know what I'm talking about. Just screw it in like this. Awesome. And the cool thing here is 0 stitches. Can you believe that? No stitches. Did you feel any pain?
Mm-mm.
Yeah? Was it good?
Yeah.
You give it a thumbs up?
Mm.
Thumbs up.
Yeah.
Thumbs up. Awesome. So, great case. Happy with the outcome. What's important is no matter how much technology we have, that doesn't replace our ability to reason and think for ourselves. When I first did the drill, I noticed after I took an X-ray that the position was a little too far to the back, more than I'd like it to be. So I went ahead, I redesigned the way I wanted it to be, and I fixed the implant position, and the result is this. Excellent. See you in the next surgery.
The issue that I experienced using this is a lot of times you're drilling, you're trying to get that drill, lined up properly so you stay on the bullseye. And sometimes it can overheat the bone, is from what I noticed, versus having a guide that you just know exactly where to go in, you go in and out. There's less opportunity for the bone overheating. So when you have the conventional CGI, computer guided implant guide that has metal sleeves, you know exactly, you go in and you go out. With this one, however, you're drilling down and you're focusing on staying on the bullseye. So what happens, you probably end up overheating the bone a little more than how you would overheat it if you were using the guide.